Good afternoon, everyone. It is vital for us all to be regularly reminded of exactly what's at stake in the battle against COVID-19. And just as we heard from our Prime Minister and from the First and Deputy First Minister last night, that's why frontline health workers are now joining me regularly at this podium. Today I welcome Dr. Paul Johnston, the Clinical Lead for Intensive Care at Antrim Area Hospital, and I thank him for being here today. So, Paul, over to you.
Okay. Thank you very much, Minister. As the Minister said, my name is Paul Johnston. I'm the Clinical Lead for Intensive Care Services in Antrim Area Hospital. I've been asked here today to provide some insight into how COVID-19 has impacted patients, particularly those who are unfortunate enough to have become critically unwell and require admission to intensive care. I would first like to start, however, by providing some reassurances that the majority of people affected with COVID-19, probably in the order of greater than 80% of people, are either asymptomatic or very mildly symptomatic. However, it would appear that numbers of severely ill COVID-19 patients are on the rise again. This can, as it did before in the first wave, necessitate admission to hospital and indeed onward admission to intensive care. In Antrim Intensive Care, where I work, we are again seeing an increasing number of patients who require intensive care support. As a result of this, an increasing amount of our bed capacity is being utilised to treat COVID-19 patients. This can, again as in the first wave, have a knock-on effect to other linked NHS services. Fortunately, our rates of intensive care admission in Antrim are currently higher than elsewhere in the province. But I do believe regionally, hospital and intensive care admissions will increase, hopefully not as rapidly or as significantly as during the first pandemic wave. Clinically, our experience with this condition points to severe and prolonged respiratory failure, necessitating, in some cases, several weeks of intensive care support on a ventilator. A high number of these critically unwell patients will also require dialysis for kidney failure. And more specifically to COVID-19, patients appear to suffer from disordered blood clotting. This results in a high burden of blood clot formation within the body, leading to potential further and more severe organ failure. Again, from our experience during the first wave, we know that a significant number of these intensive care patients who develop multiple organ failures will unfortunately die despite all our best efforts. In the UK as a whole, there have been approximately 10,000 COVID-19 admissions into intensive care, and the death rate associated with this cohort of patients is in the order of 40%. To put that into perspective, this is roughly double the mortality rate of other viral pneumonias that have been seen in intensive care over the past 3 years. In terms of risk factors for mortality in intensive care, the biggest of these seems to be age. Mortality in intensive care patients increases dramatically with advanced years. For example, those aged over 70 have an approximately 60% chance of dying with COVID-19 without really considering any other factors. But significantly, for our younger population, intensive care mortality in the under 40s has been postulated to still be in the order of 15%. In Northern Ireland, up until the end of July, there were approximately 1,200 hospital admissions with COVID-19. These admissions generated approximately 130 intensive care admissions in the region. So, if you become unwell enough to need hospital admission, you have approximately a 10% chance of ending up in an intensive care and, in effect, being subject to these aforementioned risks. The public, along with our politicians and other influential figures, should therefore not underestimate this next phase of the COVID-19 pandemic or become fatigued by prevention measures. COVID-19 is very much still with us, and preventative measures are recommended for good reason. They work to reduce spread of the disease. Frontline staff and colleagues are worried about what's coming down the line with a second wave, potentially hitting us into the winter. This is the time of the year when our health service has historically been its most fragile. To reduce the burden of COVID-19 on our hospitals, and in particular our intensive cares, we need to reduce infection rates. We do this by reducing transmission of infection, and we can achieve this by following recommendations for face coverings, hand washing and social distancing measures. And as we have seen with emerging evidence, these measures may change over time. Concurrently, we also need to reduce the burden of other winter illnesses. I would therefore encourage a high uptake of the flu vaccine, as co-infection with the seasonal flu and COVID-19 is likely to lead to a more severe disease state for those affected. It has already been shown with COVID-19 that bacterial co-infection worsens outcomes. Currently, there is no reason to suspect anything different with winter viruses. We are not entirely powerless, but we all need to be socially responsible. Ultimately, the onus is on all of us to protect ourselves and those around us by following current advice. Prevention in this case seems better than a cure that does not yet currently exist. Thank you.
Thank you, Paul, and thank you for the message, because I want to start my remarks by paying tribute to and thanking the people of Northern Ireland. So many tough sacrifices have already been made, and now we are asking for more. Earlier today, I met with one of the families who tragically lost a loved one during the recent outbreak in Craigavon Area Hospital. I challenge anyone who still doubts the seriousness of this virus to sit across the table from such a family for even 1 minute and see how sorely mistaken they are. What has happened in Craigavon and Daisy Hill hospitals show the cruelty of this virus. And I'm on record as saying an investigation is needed and that lessons will have to be learned. I can today confirm that Dr. Gudru Gopal Rao, a permanent consultant microbiologist from the London North West University Trust, has been appointed as the independent chair of the Serious Adverse Incident Review. I would also love to be able to stand here today and say we are coming to the end of this crisis. Unfortunately, we are not. There are still many months to go. Today's further 220 cases demonstrates the seriousness of the challenge we now face. R remains above 1, somewhere between 1.2 and 1.8, and our 14-day incidence based on new positive test cases is now at 85.9 per 100,000 people. That's up from 64.9. So the virus is gaining momentum. We are all so tired of this, but we need to regroup and refocus to get through it. Following public health advice and sticking to the regulations will save lives. We have to stick together. This is not about me or you or them. This is about us. And I will make this promise. We will get through it. We have prevailed against adversity before in Northern Ireland, and we will do so again. There are still many uncertainties about COVID-19, but we do know more about it than we did 6 months ago. Treatments have improved. The pursuit of a vaccine will go down in history as a monumental global effort, and Northern Ireland and we can play our part. 4,500 people here have already registered to volunteer to participate in those trials, and I would appeal for more people to sign up in readiness for when those trials go live. Because we are not powerless against this virus. We know what needs to be done: washing our hands, keeping our distance, and wearing a face covering. COVID-19 spreads through human contact. We have to keep minimising and carefully managing all our contacts. So overall, we need people to be as careful as possible in everything they do. And unfortunately, it is now necessary to reintroduce tighter restrictions on visits to hospitals and other healthcare facilities. There will shortly be new guidance published which will see visits restricted, in most cases, to one visit by one family member once a week. There will, of course, be flexibility for end-of-life care, some elements of maternity services, and for paediatrics, for example. One area, however, that I am especially keen to try to retain access to is to our care homes. Every effort should continue to be made to enable other forms of visiting, to ensure residents and patients maintain important social connections. My department has been working with the sector on the concept of care partners to assist with family involvement in the care for their loved ones. All options and all supports remain on the table and are currently being discussed and developed. As you will be aware, new rules are now in place to prevent mixing of different households. Of course, it's not possible for regulations to cover every eventuality or situation. There will always be some grey areas, and in those circumstances, I would appeal to people to use common sense and discretion. Do the right and the safe thing, because the overriding goal is to keep household-to-household contact as low as possible. While regulations and enforcement are very important, personal responsibility is also essential. We can't regulate people's lives 24/7, nor should we. We can't police COVID-19 out of existence. This is not feasible nor desirable. We don't live in a surveillance state, and we don't want to. But the new regulations do not constitute a lockdown. People can still carry on with everyday activities while following some basic rules of engagement. Continue to work from home if you can. Ask yourself how important a planned activity is for you. How much additional risk would it bring to you or others? How difficult would it be to maintain social distancing? If you look to the week ahead and reduce your number of contacts, you may well reduce the opportunity for this virus to spread. So please believe me when I say I do not want another lockdown. At the same time, we have to keep all options on the table. The best way to avoid further restrictions on our lives is to follow the ones we have in place now. Because the purpose of these restrictions is to enable us to once again move from the dark side of the street to the bright side of the road. We all have to do all that we can because we owe it to each other. I'll now hand over to our Chief Medical Officer, Dr. Michael McBride.
Thank you, Minister. Good afternoon, everyone, and thank you, Paul, for sharing those insights into the challenges that health professionals have faced in our intensive care units and the day and daily battle that they fight to ensure that people affected by COVID get the best possible care. Unfortunately, the challenges that we face will continue. They will increase in the coming weeks and months. And it is a matter of fact that, unfortunately, the seasons are not with us as we head into autumn and winter. And as you know, we can expect to see all respiratory viruses gain a foothold, unless we follow the simple steps that Dr. Johnston has indicated. We're currently seeing some 150 new cases of COVID-19 every day. Numbers are doubling approximately every 10 days. And if we do not take action now, that could become over 500 cases per day within just 4 weeks. So I want everyone just to pause And to think about that, 500 cases per day in 4 weeks' time. It doesn't have to be like that, but it is dependent on what we all do now, as the Minister has said. We're also now seeing a 50% increase in hospital admissions with COVID each and every week. And while they remain low at present, that will change and pressure will once again fall on our hospitals, on our staff and on our intensive care units. I want to now take you through some of the data in relation to the current rates of transmission. The first slide demonstrates the 7-day rolling average of new cases per day. And as you can see, that has continued to rise on the right of the graph from some 145 average over the last, has risen to 105 over the last 7 days from previously, as you recall, last week we were reporting 90 per day. This looks at the testing average over the last 7 days per 1,000 of the population. You can see that that has remained stable and static at 20 per 1,000 of the population. And that demonstrates once again that the increased numbers of cases that we are detecting is not as a consequence of increased testing, but reflects a true increase in community transmission of the virus. The next slide demonstrates the 7-day rolling average of test positivity. So these are the percentage of tests that are carried out that turn out to be positive. And worryingly, again, you can see a significant uptick in the percentage of positive tests from previously 1.8% to now sitting at around just under 3%. And again, if we compare ourselves with the United Kingdom and the Republic of Ireland, we are on the extreme right of the slide as I look at it. This is the 14-day cumulative total cases per 100,000 of the population. As Minister has just said, that currently sits at 85.9 per 100,000, and that's up again from 64.9 per 100,000, and again is significantly higher than other parts of these islands. And again, as Paul has reminded us, this is having a direct impact in terms of hospital admissions. As I said earlier, we're seeing the numbers of admissions of people with COVID increasing by about 50% per week. And the 7-day rolling average has moved now to 29, so just under 30, where it had previously been sitting at just over 20. So the message this week has been absolutely clear. The power is within your hands to suppress this virus and to stop its spread. In the last number of weeks and months, I and others have raised my concerns about fatigue and at some degree of complacency. I think it is fair to say we are all tired and fed up with this virus. We're all fed up with the restrictions that have been imposed upon our daily lives. We're fed up with the impact it has had in our interaction with family and friends, our livelihoods, our studies. But the virus hasn't weakened, it hasn't changed, and sadly, its ability to spread and cause severe disease is as it was. We have all sacrificed much over the last months. And the price, as Minister reminds us again today, has been too high for far too many. I've spoken before of the fact that we stood at a crossroads, which required both individual and collective decisions, and that we had, all of us, hard choices to make. Now, while the executive can regulate and others can enforce, and we can provide advice, as Minister reminds us, it's really up to all of us. You will choose to follow or not, to be responsible or not, and by your decisions and actions, not only take risk upon yourself, but also choose to expose others to risk. Others who are more vulnerable, others who you may not know, and some who you will know. We came together in the first wave of this pandemic, only like people in Northern Ireland can come together. I ask you now not to give up. I ask you not to give in. Do not be deflected. Do not lose your commitment. We have a few short weeks to reduce the spread of this virus and avoid much worse to come. We have a narrow window of opportunity. We must all act now, or we all will face the ultimate consequences that we saw in the first wave. So we are at that fork in the road. We can all decide and determine the path ahead. Your decisions in the next 2 weeks, what you do and what you don't, whether you follow the advice, will determine where we are. We don't get a second chance. We don't get a chance to retrace our steps and say, well, let's do it all over again. The decisions, the actions that you take in the next 2 weeks will determine where we are 2 to 3 weeks from now. It's as simple as that. So we all need to reduce our contacts. We need to socially distance. We need to wash our hands regularly and frequently. And we need to ensure that we wear face coverings. When you do that, you choose not to expose others to risk, those you know and those you don't. And particularly to all of those who have been shielding, I would say, be particularly careful at this time. To our young people, I say this: you have put your education, your training, and your livelihoods on hold. Now it's up to all of us to make space for you. Please respect and demonstrate you understand that. This matters because it's all about lives, livelihoods, and all of our futures. So, as Minister said, there is light at the end of this tunnel. I ask for 6 months more commitment from you, as if your life depended on it, because your life, and potentially the lives of others close to you, does depend on it. Please, let's look out for each other, and please, let's all continue to work to get through this together. Thank you very much indeed.
Hi there, it's Louise Cullen here from BBC. The first question is about those rising case numbers. When you look at the 7-day average in various local government districts, you can see the increase in places like Belfast, Newry, Down, and in particular Derry City and Strabane, which is now sitting at an average cases number per 100,000 that's higher than Birmingham and Leicester. Does that raise the possibility then of further tightening restrictions or even possibly going to localised lockdowns?
I think one of the things, Louise, we did at the start when we looked at postcodes individually was look at the incidence in those specific geographical areas. We are seeing now, again, an increase in further geographical areas over the past 7 days, and you've indicated some of those that are available and that information from our dashboard. We've always been clear, if we do have to introduce further restrictions, we will do it. I don't want to go to the language that we will look at lockdowns at this point in time, but as the last resort, that is what we will have to do if the interactions and the guidance that we introduce now does not have the effect that we want it to have over the next couple of weeks. One of the things we did when we introduced the local postcode lockdown initially, and what we were beginning to see in BT43 in Ballymena, was actually a decrease in the incidence of cases over that period of time. So we have evidence that what we've introduced across Northern Ireland wide actually does work, but we rely on the people of Northern Ireland working with us as they did before in the first wave.
And if I could just ask as well, you mentioned meeting the Fleming family this morning who lost their father, husband and grandfather in the outbreaks at Craigavon Area Hospital. That SAI is now obviously getting underway. You've appointed the chairman. There's another level 2 SAI in the Northern Trust regarding a death in the Antrim Area Hospital. It's not got underway. We're facing into a winter like no other, as Dr. Johnston said. Is an SAI, which can be slow and cumbersome, really the most efficient way to figure out how this virus got into our hospitals and how we protect them against it as we face into this winter season?
The learnings from the hospitals, and this has been covered by a number of urgent orals and debates within the Assembly, the learnings is current, it's ongoing, and it's what we are doing now. We're involved, the Public Health Agency, Public Health in England, is already involved in the Southern Trust and talking to your Trust chief executives to make sure the learnings are there on now, and about reinforcing all the good practices that we had across our health and social care system during the first wave. The SAI is very specific about what has happened, and that's about seeing what went wrong, where it went wrong, and what needs to be improved. So the SAI is a longer process about the very specifics of what happened, but the current learnings are current now, and those lessons are being presently learned and implemented. Maybe, Michael, if you want to say a few words on.
Yes, Louise, thank you. And I think that, yes, for many families, the SAI process can seem protracted and prolonged. And, you know, having spoken very briefly to the Fleming family today, I know that they want answers to reasonable questions. And what I can say is that to provide those answers requires complex and detailed examination of a variety of quite complicated factors which may have contributed. It's important that that work is undertaken thoroughly, and we will undertake that work and complete it as quickly as is possible. However, as Minister said, that does not prevent the immediate learning in terms of when incidents such as this occur, and the sharing of that learning across other trusts. And indeed, there are other mechanisms in place to ensure that that rapid sharing of the learning happens. Sadly, with the levels of community transmission that we are seeing at present in Northern Ireland, we will see further outbreaks in hospitals, in care homes. That is why it is crucially important that the action that we take over the next couple of weeks is effective in suppressing levels of community transmission so we can reduce that risk. This is a highly transmissible virus, and that is, despite all our best efforts in terms of infection prevention control, the use of PPE, this virus will get in to hospitals and other settings where there are vulnerable people, and we need to do everything that we can as a society to ensure we reduce that background level of transmission.
Mark, you're still on mute.
You're on mute still, Mark. That's you now, I think.
Hopefully you can hear me now.
Yep.
Excellent. Question first of all for the Chief Medical Officer. Dr. Michael McBride, Tom Black of the British Medical Association today said that it could be presumed that we have entered a second wave. He said that one issue of concern would be the fact that before we were 3 or 4 weeks behind England, we are now getting more infections than England, Scotland or Wales at the moment. So he is assuming that we are now in the throes of a second wave. Is that an assessment that you would share?
I really don't like the concept of waves because it always creates the impression that somehow the virus has a plan and that we're powerless to do anything about it, that there's going to be a natural cycle of the virus coming through society, spreading and then falling away again. It doesn't work like that. It really depends on what we do. So we have the opportunity now, a very narrow window of opportunity, to avoid the situation that Tom is alluding to. If we don't use the next 2 to 3 weeks to heed the advice, follow the restrictions, do what we all know we should be doing, then yes, we will see increased levels of community transmission. That will translate into more admissions into hospital, more admissions into intensive care for Paul and his colleagues to look after, and sadly, more deaths. There is an inevitability that that will happen. Whether you call that a second wave or not, is a moot point. But things are going only in one way at the moment, and that's the wrong way. And it's up to all of us to redouble our efforts to make sure that we suppress this virus and limit its spread. And we know how we can do that. We did it before, we can do it again. What we want to avoid, as Minister said, going into a full sort of lockdown situation as before. And what we need to look to is introducing incremental, proportionate interventions that will slow and suppress the spread of the virus.
Okay, Minister, I do want to come to you in a moment, but while we have Dr. Johnston with us, Dr. Johnston, you spoke very, great detail there about the dangers of getting COVID and being admitted to hospitals. We talk about not wanting to overwhelm the NHS, which is a system, a great world-class system, but it's full of people, whether they're patients, whether they're nurses, whether they're doctors. How are you guys holding up?
It's a very difficult question to answer. Everybody manages in a different fashion. Ward staff perhaps don't see as much of the very severe end of the spectrum. Intensive care staff would. Certainly from an intensive care point of view locally, Many of our nurses have had to avail of psychology services after some of the episodes that they've witnessed with patients in our care. So I think different areas of the hospital manage differently. Different areas of the hospital are affected differently. Respiratory wards and intensive care wards tend to be the most heavily affected, and certainly this is where the sickest patients are. So the staff in these areas are the staff that are most vulnerable to the effects of having to deal with the stress associated with patients who are severely unwell with COVID-19.
Okay, Dr. Johnston, thank you. And Minister, obviously an executive meeting tomorrow when you will look at the different restrictions that are in place at the moment, and presumably it will be too early to see what effect the opening of the wet pubs today will have on restrictions. Is there a likelihood that we are heading towards a second lockdown? Boris Johnson spoke last night in his televised address about different lockdowns in parts of England, but yet Arlene Foster was keen to say that we're not in a lockdown. Is there a certain inevitability that we will end up in a lockdown for a period of time?
Mark, first of all, can I thank you for the question you actually asked Paul there? Because so often people actually forget about the human side to our health service, to the staff, and to our colleagues across the entire health and social care system, who are putting in tremendous efforts, have put in tremendous efforts. And thank you for actually asking about how they are, because I think too often when we get to this stage and when we see the challenges to our health service and the health department, people forget the human side behind it. In regards to the inevitability of a lockdown, what we're asking here today, what the First Minister and Deputy First Minister said last night, was a very clear message, and it comes from the Chief Medical Officer. It comes from Dr. Johnston here standing with us. It came from Roisin Devlin last week. If we interact now, if we take those steps that we took a few months ago, social distancing, good hand hygiene, good respiratory hygiene, face coverings, we can prevent going into a further lockdown. This is really in all our hands at this moment in time. We can bring forward regulations, we can bring forward guidance, but we're really asking the people of Northern Ireland to give that extra commitment and that extra bit of self-sacrifice to get us back into the place where we were during the summer months.
Good afternoon, it's Michael here from the Press Association. I was listening to Diane Dodds giving evidence earlier today, and she said that local businesses cannot be locked down again and that it will destroy many of them. If we get to a situation where there's 500 or 600 new cases a day, are you willing to override what she says?
It's not about overriding any minister. It's about the executive taking that collective decision that we've always taken for the interests of the people of Northern Ireland. And I think the First Minister summed it up well in one of her comments when she said our interactions and the steps that we take are also to protect not just livelihoods but lives, because the two come with a balance, and it's not about one minister overriding the other but the collective working agreement of the executive to make those decisions that may be necessary when they're necessary. But I definitely won't take anything off the table, but it's about taking the appropriate steps at the appropriate time.
Could the Chief Medical Officer maybe address that question as well, please?
Yes, Mr. Michael, yes, thank you for that question. I mean, the Executive has been very clear throughout, as indeed I have been, that this isn't about one aspect trumping another. This is about balancing the health impact of COVID-19. Don't forget, whenever we put restrictions in place, yes, that suppresses the virus, but also there are serious health consequences. We saw those in Wave 1 in terms of access to health services, although our health service responded splendidly to try and provide those services in an innovative way so people could still access them, but no doubt, and we have seen significant adverse health consequences as a result of those measures. So what we always do, and the Executive always looks at, is the benefits and disbenefits in terms of any intervention in terms of health, the wider societal impact, because we need to look at that too, but also the economic consequences. And I've said before, and I say it again, as Minister, as Health Minister, as Chief Medical Officer, I'm as concerned about the wider economic impacts, because I know that people's livelihoods, employment opportunities and poverty ultimately kills people. It is bad for people's health. So that's the challenges that the executive has to basically ensure that we prioritise those three areas and make sure that any decision that is made is informed by what the benefit is versus the disbenefit, whether that's in terms of wider health, the economy or society.
Good afternoon, Tara McLaughlin, Downtown Radio, Kill FM News. I just want to ask you first, Health Minister, are there any plans, given the increased admissions to hospital, to step up the Nightingale services, and where are we at with the second Nightingale hospital?
There's not at this point in time, Tara, but the Nightingale facility in the Tower block of the Ulster, which was our ICU, Nightingale is there and is able to be turned on. Paul and his colleagues are currently managing the number of cases we have in ICU, but I'd rather see less people entering ICU because of COVID than taking the steps that we need to ramp up those Nightingale facilities. There is work ongoing in regards to the White Abbey facility, the Nightingale facility, which will be a step-down facility for those coming out of hospitalisation that need support after having contacted COVID and actually on the recovery process. So that work still is ongoing.
And a question for Paul then, secondly, please. We saw at the start of this pandemic a few concerns over the amount of ventilators in Northern Ireland. Is that a concern for you, or have you had any experience of a lack of facilities?
I wouldn't have any regional oversight, but certainly from a local point of view within the Northern Trust, facilities, equipment and staffing were issues that were raised well before we had a COVID patient in intensive care. These issues were addressed largely through our procurements management system within the hospital, and eventually then our regional service, CANI, which oversights the intensive care beds, became involved and helped to procure dialysis machines and ventilators and various consumable products. If anything, it's probably more the consumables that go with the machinery than the machinery themselves that could have become a problem. But fortunately, with the numbers of patients that we had regionally, I think we ended up actually that we were adequately equipped, and we had adequate amounts of consumables. There were a few things in terms of PPE requirements that came close, but I don't think at any point locally we ever ran out of anything.